Assalamualaikum warahmatullahi wabarakatuh. In this video, I would like to retelling the comic with the title is A Nurse's Anguish in the ICU. This comic tells about a nurse named Jessica. She is 23 years old and she is an ICU nurse. Everything has changed in the past 11 days since the first case of COVID-19 hits our ICU. Now, all about 20 beds in ICU filled with the patient COVID-19. Then it made the nurse scared and sad about this. She was afraid that she could carry this virus in their home and then infect her mother and sister. Then to protect herself from the coronavirus, she wears PPA when interacting with the patients. In this case, there are many patients with different cases, such as there is a father who's his family waiting for him, and then to return home, and their family has had plans to go to the beach together, but didn't because the this father was passed away because COVID-19. And then the next cases is this is a mother with age 38 years old who has two children, two small children, and then she will for over an hour. Jessica tried everything she could, correcting her sedation level and checking her blood pressure medication. And she hopes that in 2 days, the patient of a mother who has two small children still be here or still be in ICU. And then after the next shift was end, Jessica sat in the hospital parking for about 50 minutes to encourage herself to come back home for her mothers and sister. What do you think about the story? And I think it tells about how hard the nurse worked to help the patients who infected with the COVID-19. And every day, the nurse was panicked and then so sad to see there are many the patient would die and then in critical condition. And what do you think about the author's purpose for making it? And I think the author made this comic to tell how a nurse sacrifices life and death to treat patients so they can what is that recovery and can return with their families. So we as readers must know how dangerous the coronavirus is and appreciate as a reader must appreciate the works of medical personnel even more. That's all for me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.